Hi, my name is Moshe Weiland, and I am a physical therapist. Recently, someone asked me about the timeline of their recovery after surgery. So I find that question hard to answer because there are so many variables. However, there is another question that I think will actually get the person more bang for their buck. So the reason why I don't like answering that question is that there are just so many variables to factor in. Was it a trauma? Was it a degenerative issue that's causing them to have surgery? What actually happened in the surgery? Because, the surgeon doesn't always tell you exactly what happened in the surgery. They might have had to cut more or less, and the more they cut, the more tissue that he needs to heal. The less they need to cut, that's why arthroscopic surgery has been such a godsend to people, is they don't need to cut that much in to get in, do their job, and get out. So that's one of the reasons why it's hard for me to tell the timeline. Then there's all the other variables, and which are possibly controllable, which is why I prefer the question, what could I do to speed up the recovery? So for many people, surgery is traumatic, understandably so, and it throws you off your game a little bit. So a couple of things to get you back on your game so that you could recover better are sleep. Often people who've had surgery, it's disrupted their sleep because after the surgery, they might not be able to sleep on their side. They might be in pain. They might be itchy. There's so many different variables that happen after surgery that it could disrupt your sleep. Also, people are less active, not more active, they're less active after they have surgery. So you might not accrue the same amount of sleep debt, and therefore it might be harder for you to fall asleep. Also, it's fairly common for people to have more pain at night, whether that's because there's a lull in your day or because of the nighttime daytime cycle. I'm not 100% sure, but I've heard it from enough people and I've experienced it myself where like sometimes pain is greater at night than during the day, and there has been no reason for that. So you might need to be extra diligent on sleep hygiene, whatever that is for you. For me, I find dimming the lights and like ramping things down does better than, okay, time to go to bed. If you're exhausted, you'll just conk out, and something to factor in. Nutrition. So I like to eat. I like sweets, but sweets do not build muscle and tissue and help you rebuild blood and all these other things that you're going to need after you've had surgery. And after you've had surgery, you might have trouble doing shopping and cooking and cleaning and all those other things. So there are protein shakes and there are, energy dense foods and some nutrition dense foods or whatever. And if you can prioritize that, you might find it really helpful. I've suggested increasing protein content to a number of my clients, and they've really found that it gave them an extra boost of energy. Pain. Yeah, they've cut you open, they've rearranged things. There is a high chance of you having physical pain. It's not ironclad. There are people who have major surgery and they're fine. They never break open the pain meds. Everyone's different. Pain does not mean structural damage because sometimes you could be excruciating pain and have like nothing that shows up on an MRI, X-ray, CAT scan, anything. It's not all in your mind. It's just the way your nervous system is wired then, and there's pain science. There's ways of possibly addressing it. Some people take pain medications. That's up to you, between you and your doctor. Some people find the side effects of the pain medications just intolerable, foggy headedness, constipation, whatever. They're like, forget about it. I'm not dealing with it. There are non pharmacological or more conservative ways of addressing pain. They're finding that, muscle relaxants or gabapentin, certain things that work on the nervous system level can be helpful. So if you are in a lot of pain, but you can't deal with the side effects, you can talk to your doctor, guided imagery, self-hypnosis, hot, cold. There are options. Um, Therapy, as you can probably imagine, I'm a physical therapist, so I am a big fan of people doing movement. I don't like doing exercise. Most people don't like doing exercise, but movement is fun. People like to dance, people like to bike ride, people like to rock climb. It's fun. After surgery, you might have to take it easy. That does not mean you stay in bed all day. I've had clients who are petrified of doing any damage, that they wouldn't do any exercise, and that made things worse. Then I've had clients who I'm like, no, your doctor specifically told you not to do that. What were you thinking? Luckily, none of them had permanent damage, but I'm just like, no, don't walk your dog after you had shoulder surgery, after he's the one who pulled you into the wall in the first place. Um, it's important that it be appropriate movement. It's important that you don't overdo it. It's very easy to overdo exercises. Work with your therapist. That's why it's really helpful at the beginning to work with a therapist. There's been a movement with doctors to, I think it's called quiet rehabilitation. Things were going too aggressive and people were not responding well to surgery. So they decided, okay, let's hold off on the physical therapy until the tissue heals. I don't totally understand it because I've had clients who like really needed to be told what not to do and less of what to do. And whatever, he came once or twice, once a month for 2, 3 months. And then he was like, okay, I'm good to go. I'm like, fine. Okay. You might need to push for physical therapy. I had a client, she said the doctor would not prescribe physical therapy for 10 days. He might have his reasons. You know, sometimes the surgery was done in such a way, it's just safer to leave it alone, let the sutures heal, let everything heal, let the pain tolerance go down. After surgery, you're probably not going to want to go to a clinic. You're probably not going to want to do things. You might, but so knowing that, you know, but just movement. The doctor says you can walk around the house, use assistive advice, whatever. Don't spend too much time sitting on a lazy boy, the couch, or the bed, or whatever. Keep it moving. So that's why I really have a hard time telling people the timeline of the recovery, because there's so many different variables, and I prefer to focus on what can we do to speed things up. And I hope that was helpful.